The member for Fraser.
Thank you, Deputy Speaker, and may I extend my thanks to you for taking the chair to permit me to participate in this debate. Deputy Speaker, this bill before the House is about fairness. It's about striking the right balance on how we spend our public dollars. So often in public life we campaign in and. We speak about all the good things that government can do, and it's true, the potential of government to do good things is great, but ultimately we have to face trade-offs. Governing is really more about questions of or than questions of and. You see that very much with the coalition at the moment, Deputy Speaker, mired in their $70 billion black hole, the equivalent of stopping Medicare for 4 years or the pension for 2 years, simply because they've been unable to make these hard choices. But we are making the hard choices, Deputy Speaker, and one of those is to recognise that money that currently goes to subsidising higher income Australians to take up private health insurance could be better spent in the Australian government system, including on important healthcare measures. Those opposite want you to think, Deputy Speaker, that we're against private health insurance. Nothing could be further from the truth. It's another part of the opposition's ongoing scare campaign to suggest that the government is against private provision of health, or much as the opposition often suggests we're against the private provision of education. It's not true at all. The private health system is an important part of the Australian healthcare system. But what we're doing with this bill, Deputy Speaker, is recognising that the government need not subsidise the private healthcare of millionaires. It is not vital to a millionaire that they receive a 30% private healthcare rebate in order for them to take up private health insurance. The first people to take up private health insurance, Deputy Speaker, were millionaires. Those millionaires will have that private health insurance when their 30% rebate isn't there. And that's true even broadly across the spectrum. We know, we have strong evidence that the take-up of private health insurance did not increase markedly when the 30% private health insurance rebate was put in. In fact, what the policy change that substantially increased the take-up of private health insurance was the lifetime health cover reform. Lifetime health cover had a much bigger impact on the take-up of private health insurance than did the 30% rebate. Deputy Speaker, in putting in place this fair and equitable reform to the health system, Labor is doing as we always do, ensuring that Australia's healthcare system looks after the most disadvantaged in the community. It was us that introduced Medibank under the Whitlam government in 1975, and it was us that rebuilt that system into Medicare under the Hawke government in 1983-84, after the original Medibank had been trashed by the Fraser government. We believe in making sure that all Australians receive high-quality healthcare. Too often, those opposite appear to be taking their cues from their colleagues in the United States, from US Republicans willing to laugh at low-income Americans who don't have the money to afford private health insurance. But that's not the Labor way, Deputy Speaker. We believe that we need to have a healthcare system that recognises that good quality healthcare is about making sure you can participate in society. If you don't have good quality healthcare, you're unlikely to be able to hold down a job, and you're unlikely to be able to participate fully in the social life of the community. So healthcare is, like education, a critical underpinning to a fair society. Under this bill, the private health insurance rebate for low and middle income earners will remain unchanged. Higher income earners will receive a reduced rebate as income increases. The private health insurance rebate will progressively fall. It'll ensure savings to the government, $2.4 billion over 3 years, over the 3 years 2012-13 to 2014-15, and it'll provide a fairer distribution of the benefits of the healthcare system. Deputy Speaker, my own electorate of Fraser has above average incomes in Australia, but even so, the number of people who will not receive the private health insurance rebate is very small. I'm informed that the number of singles in my electorate who will no longer receive the private health insurance rebate is 2,220, the number of couples 740. A relatively small number in an electorate whose total population is now pushing up towards 200,000. We do not expect that change to lead to any substantial change in private health insurance coverage. We have modelling from Treasury which finds that 99.7% of people will remain in private health insurance as a result of the fact that we still have incentives such as the lifetime health cover and the Medicare levy surcharge. So $2.4 billion additional into the budget to be spent on better healthcare initiatives and a minuscule change in private health insurance coverage as a result of this. The scare campaign the opposition is running need not just be rebutted by Treasury figures, sound as they are. Professor Elizabeth Savage, health economist at University of Technology, Sydney, has done considerable work in this area. Her research shows strong evidence of habit, persistence. So the take-up of private health insurance is likely to endure because those who already have private health insurance will continue to follow down the same road. Professor Savage also finds that means testing the private health insurance rebate will not increase pressure on the public hospital system. Again, another furphy, another scare campaign from those opposite. There are nearly 8 million private health insurance policyholders who will not be affected by the changes at all. As a result of these changes, I've said, Deputy Speaker, 99.7% of people will remain in private health insurance. This allows us to have another $2.4 billion over the next 3 years. What will that get spent on? Well, you can expect it to be spent on services such as our improvements in the hospital system. From the 1st of January this year, we're ensuring that every state improves the proportion of emergency department patients seen within 4 hours. Recent academic research has shown that will save lives. We're expanding Medicare locals to integrate the sectors, make sure patients get holistic care. We're putting in place local hospital networks, making sure that decisions about hospital management are devolved to the local level. All of these reforms will save lives. Ultimately, that's what great healthcare does. So we are here talking about an opposition who would prefer to have private health insurance rebates for millionaires than have a healthcare system that saves more lives. We're delivering mental health reform. We're rolling out additional headspace centres, EPIC centres, and also looking at mental health reform across the life cycle. We're committed to putting in place the groundwork for a national disability insurance scheme, a scheme which the Coalition, when it was first proposed by the Productivity Commission, said that they supported, but are now unwilling to support in the short term. The Coalition are walking away from expanding support for people with disability, despite the fact that their own spokesperson on disability, Senator Fifield, acknowledges the current system is a patchwork and contains many anomalies for people with disabilities and their carers. The Coalition would again prefer to subsidise the private health insurance of millionaires than to begin putting in place a national disability insurance scheme. Politics is about choices. Ours is national disability insurance ahead of subsidising the private health insurance of millionaires. Theirs puts subsidising the private health insurance of millionaires before better disability care. We're building a stronger aged care sector, again recognising that the aged care system is in urgent need of reform, recognising that the aged care system, if we don't do something to improve it, will face considerable strain as the baby boomers strike their retirement and increasingly look for places in aged care homes. Deputy Speaker, politics is about values and what you value. And what you prioritise in government shows what you value. During the global financial crisis, we chose to save 200,000 jobs, tens of thousands of small businesses. They say that they would not have taken on debt, meaning they would have cut back government spending in the face of the global downturn, throwing Australia into a deep recession. On taxes, we're delivering pension rises and income tax cuts for working households through our Clean Energy Future package. Under the opposition, if they're under a Tony Abbott government, the only people who would get tax cuts would be big miners and big polluters. You can see the same in education. For us, we're investing in low-income schools through the Low SES National Partnership, the Gonski Review, ensuring a fairer system of federal government funding to schools, and recognising that it is important to support need. For them, any rebalancing of schools' assistance is immediately fear-mongered about. They immediately suggest that what we are doing is creating a schools hit list. Nothing, Deputy Speaker, could be further from the truth. On the public service, since Labor has come to office, there has been modest growth in the public service, in the order of around 11,000 additional public servants, a rate of growth slower than the final years of the Howard government. We recognise that a strong public service is vital to delivering services such as better health care. But those opposite would make 12,000 public servants redundant, a commitment that the member for North Sydney has again made on the Q&A program this week. In that program, in fact, the member for North Sydney said that there were 6,500 people working in the Department of Health, and he appeared not to be sure what they did. Well, Deputy Speaker, I can say two things about that. First of all, there are about 5,100 people working in the Department of Health, a small increase of about 300 since the Leader of the Opposition was Minister for Health. And as the member for North Sydney could find out if he spoke to, say, the Leader of the Opposition, the Department of Health does enormously important work. They're working on private health insurance rebates, they're working on preventive health, they're working on the pharmaceutical benefits scheme, and I commend the work of the Department of Health officials that has gone into preparing this package of reforms. We on this side recognise the Department of Health does valuable work. Those on that side of the House would be happy to cut the Department of Health. I'll be interested to hear in subsequent contributions if the member for Dixon supports the views of the member for North Sydney that in fact were the opposition to be elected government, that he should preside as Minister for Health over a department that employed no one whatsoever. Does the member for Dixon believe that the Department of Health should be scrapped? And if so, what portfolio would he then seek to retain? Deputy Speaker, the contrast in Australian politics could not be clearer. The opposition is always saying yes to special interests. They're always saying no to tax reform. And Deputy Speaker, I'd just like to conclude on this. The contrast can be seen nowhere more clearly than in the area of dental health. Professor Jeff Richardson from the Centre for Health Economics at Monash University has found that if you look at people in the lowest income groups, 17% have no teeth, compared to 0.3% of high income people. This is in an AM interview on the 8th of December last year. Yet those in the lowest income categories are receiving much less assistance from dental care than those in the highest income categories. Those in the highest income categories have 30% of their dental care bill paid for by the Australian taxpayer through the private health insurance rebate. Labor believes this is the wrong way to balance our health system. We believe we ought to be spending less on the teeth of millionaires and more on the teeth of the most disadvantaged Australians. I commend the bill to the House.
Member's time has expired.